Hi everybody, this is Professor Butler, and this is going to be your asynchronous lesson on childhood infections and communicable diseases. There's three parts to this online lecture. The first part, we're just going to talk about some communicable diseases, and then we're going to talk a little bit about skin. And when I say communicable diseases, I'm really talking about vaccines and how diseases spread. So it's going to probably be a little bit of a review at first. And then we're going to go into the role of skin and talk about preventing skin breakdown and rashes, how they appear in children, because they're highly correlated to a manifestation that you will see in some communicable diseases, which will be the last part that we're going to talk about, some common childhood diseases that we see in children. All right, so let's go ahead and get started. So the first slide really just talks about over the years how the incidence of communicable diseases has declined due to the use of immunizations. A contributing factor is the early identification of infectious agents through surveillance and screenings that we do for our children throughout the ages and stages. Primary prevention is using immunizations, and other methods are also key as far as education on proper hand washing, wearing masks, and doing some good preventive measures. When a provider comes in contact with a child who has a possible communicable disease, it's important to always ask questions such as recent exposures to infectious agents. We ask that question all the time when they come into our care at Children's. Also ask for any symptoms, meaning what were some of the things that you may have saw, like rashes, fevers, any type of manifestations that could occur before the illness, meaning other symptoms occurred. Were they traveling at any time? What is the child's immunization history? And is there any family history of having certain diseases or infections? So communicable diseases, the educations in specific, like I said, primary prevention is immunizations. But also infection control policies that we use not only in the hospitals, but also in the schools. Proper hand washing using warm water, if you have it, soap, and the duration of actually cleaning and the method of cleaning. You guys know this from foundations, but a lot of times we have to get a little creative when teaching children, as well as anybody, to be honest, that's not really familiar with how do you properly wash your hands. And how to actually sneeze, or when you do have to sneeze, there's no real proper way to sneeze, right? Everybody has a different type of sound when they sneeze. But how do you cover your cough? Teaching children how to do this, and you can teach children as young as toddlers how, if you feel like you got to sneeze, what do you need to do? And then again, hygiene measures in school, in home and school. We're going to talk a little bit about transmission-based precautions and how things spread throughout the community. So transmission depends on the completion of the triangle, where you see here you have the agent, the host, the environment. Excuse me, I have to cough myself. Excuse me. So I'm going to grab these little tools that I can use so hopefully point certain things out. Let me see here. I'll just use red since this is black. So the antigen or the agent or the pathogen is a virus or a bacteria or something that is basically trying to get into a host, which is usually a human, or it could be an animal, or it could be an insect. The environment really speaks to the environment that is conducive for this virus or this bacteria to actually spread throughout the community. The route of transmission can be done in multiple ways. Horizontal is person to person, either through direct contact or sexual contact. Airborne is also another way. Vertical is usually from a parent, a mother, who is basically transmitting the virus or the disease through in utero. And that can happen with certain conditions. So you have to always think about, is this environment, like certain environments like Georgia, for example, we have certain things that we have more prevalent than in other countries or other areas in the United States. And then we also need, for example, I'll just say, for example, we have certain ticks, we have certain insects that we will talk about a little bit later, and that are usually found, arthropods are usually found in a specific region. Therefore, we might see this condition or this communicable disease more in our area than we would see it, say, in Colorado. So this triangle here is just a reminder that, you basically need these three things to be really prime in order for the transmission to actually occur. If you can break one of these things, like change the environment a little bit, maybe if you have moist areas, keep it dry. If you have more prevalence of increase in mosquitoes or whatever the case may be, we're going to decrease the chances by maybe fumigating. Maybe protecting the host by using certain things like masks, teaching them to wash their hands, keeping distant, avoiding crowds, and then of course the pathogen. So we can't really necessarily do anything to the pathogen, but we can immunize, right? If we know that there is something that we have a good vaccine for that to prevent it, that would actually break the triangle of transmission. So now the next slide really just talks about different types of immunity. So our goal is always to reach what we call herd immunity. That is 80% or more of the population actually is vaccinated against a possible communicable disease through vaccinations. So herd immunity obviously is the bottom, but that is the goal, to always reach that. If we can get to that point, that would be great. This is also some other terminology here about different immunities. So first, resistance. And resistance really just talks about the ability of the host to withstand the infection. It could be an acquired resistance, or it could be a natural resistance. For example, I like to use, I believe I'm doing this correctly, so I like to use the example of sickle cell disease. There is a genetic marker that Africans versus African Americans have that makes the Africans more immune. And it's escaping my mind, and I'm so sorry. I should have thought about this beforehand. But this is a genetic marker that Africans have, that African Americans have over time not developed from a genetic standpoint, which basically puts us more at risk. And it has a lot to do with a particular disease over in Africa. So if it comes back to me during this recording, I will let you know, because I believe it's like on the tip of my tongue. But it basically makes them more resistant to getting sickle cell disease, which is not a communicable disease, but still makes them more resistant. But there are also certain factors, genetic, it could be cultural, that makes people more resistant to getting a disease. So therefore, their immunity is better than other people who are more at risk. Natural immunity. So natural immunity is basically the innate resistance to an agent. Acquired, also known as humoral immunity, is getting the disease and developing antibodies naturally, which is a lot where we hear this a lot. A lot of people want this to happen naturally, but it also puts them at risk depending on their ability to really fight against the condition. Active immunity is created through immunizations. So somebody getting a vaccine, they will develop an active immunity. Passive immunity is delivered through the mother to the child. Highly common passive immunity is IgG or IgA. That is an immunity that is automatically given to a child before they're born and it kind of helps protect a child after they're born initially, along with there's other things that the mother passes on, but that's just an example. And then we already talked about herd immunity. So the next thing we're going to talk about is disease development spread. Again, these are definitions that I want you to be mindful of, and I want you to be able to identify when I'm talking about these different type of immunities and how does this spread and the different preventions. So we're going to start with the stages of an infection. So the incubation period is the time when an infection occurs to the sign of the first symptom. So people do get infected, but they don't realize they're infected until they get their first symptom. Like whether it could be a fever, it could be a rash, it could be like, I just don't feel well. That is their first symptom. So it could be weakness or lethargy. The prodromal stage is the time from not having symptoms to the very specific symptoms in the very specific symptoms. That is another time marker. So it kind of gives healthcare professionals an idea of what exactly could be the agent, because each one typically has an incubation period or time period that they dwell, and then symptoms start to present themselves. Illnesses, the signs and symptoms are actively present. Convalescence is when symptoms have completely resolved. So the communicable period is the time that a host can transmit the infection to another person. So this is when they are basically infectious. And this is the time period that we usually say that they can't come back to school. The time period where they need to isolate themselves, because we know that they can now, at that point, they can transfer. Golden rule also is if somebody has a fever, they are infectious. I don't know if you've heard that before. So if somebody has a fever, we don't want them near anybody, because they are considered very infectious, and they can definitely transfer whatever they have to somebody. And then last, we have the classification of the spread of disease. So an endemic is the presence of an infectious disease in a geographical area or population. So for example, you can think of pertussis. So we do have sometimes outbreaks of pertussis in specific pockets of different areas in the United States. An epidemic, which we just went through. No, we went through a pandemic, sorry. An epidemic, it started as an epidemic, then it turned into a pandemic. So an epidemic is the occurrence of infectious disease in an above normal expectancy. So we expect to probably have a few cases here and there of X, Y, and Z, but when we get a surge, is what we call it, that means that we might be looking at an epidemic depending on the numbers. And it could be due to either certain environmental conditions. It also can be due to low vaccination rates. And then a pandemic is infection occurring worldwide, and it's affecting large number of people and populations. Eradication and elimination is the last two. Elimination is basically the removal of a disease from a large area or region, but it may exist in another area. Eradication indicates that the disease is removed worldwide. So for example, smallpox, I believe, is because I think I've heard about some cases, and that could be because they just weren't vaccinated, but basically smallpox is considered eradicated. I would say Ebola, but that has reared its ugly head, but smallpox is the only one that I can think about. I know that there are somebody did destroy their smallpox. I think Europe destroyed their smallpox. So there's there was 3 countries that had the virus under guard and lock and key. So just in case they needed to use it, I don't know why, but it's here in the United States, right here in Atlanta, our own CDC. There was one in Europe, and there's another one, I believe, in Canada. I'd have to look it up. When we used to do tours at CDC, and they're the ones who gave me that knowledge. But I remember hearing that one of them destroyed their smallpox. They got rid of it. So anyhow, so those are the terminologies. So make sure you are familiar with them. Lastly, we're going to have some vaccine terminology as far as what type of vaccines are basically described as. So we know what a vaccine is. It's a suspension of live or inactivated microorganisms or fractions of a microorganism administered to induce immunity and prevent infectious disease or its sequelae, meaning its symptoms. So we have the first one is a live annotated. Basically, this is a reduction in the virulence, meaning how infectious the pathogen is. And they do it through measures such as treating it with heat or chemicals so that it cannot make the person really sick, but it's enough for it to cause their immune system to create antibodies. Live vaccines are just that. These are vaccines that are not, they're not the actual one, but they are live vaccines, and they're going to create some symptoms to create the antibodies. So some examples are MMR, rotavirus, smallpox, chickenpox, yellow fever in Africa. And so those vaccines, you have to be very careful because they are not allowed to be administered to people who are already compromised. So either we have to delay it, or they have to get another version of the vaccine. Also on there should be flu, because there is a flu vaccine that they cannot get that is kind of a live flu. Inactivated vaccines are flu, polio, rabies, and hepatitis A. So obviously these are inactivated versus activated. And toxoid vaccines, example are diphtheria and tetanus. These are modified bacterial toxins, not viral toxins, bacterial toxins that have been made non-toxic, but they retain their ability again to stimulate the immune system to create antibodies. All right, conjugated vaccines, example of this is the Hib flu. This one is a really good one as far as getting close to, it's not eradicated, but it's pretty much eliminated. This one has a carrier protein with proven immunological potentials to combine with like a less, like it says here, polysaccharide antigen. Basically, this one uses protein and certain sugars to create the immune response. And this one is, Hib B is a great example. We'll talk about this one more in respiratory, but this one has almost eliminated H flu. Next one is the monovalent vaccine. This vaccine is designed to vaccinate against a single antigen or organism. So this one example is hepatitis B. And the new one on the scene, mRNA vaccine, which is why there was a lot of controversy about this one, because they've been trying to make these vaccines for a long time, and then COVID came along, and COVID is the first example of an mRNA vaccine. And then I also just want to make sure you guys know that IgG or IVIG, you might have heard it. This is a sterile solution containing antibodies from large pools of human blood plasma. This is usually given when we have somebody who has a massive immunity response to something, and it helps to decrease the inflammation or the reaction going on within the patient. It is a blood product, but it also does it also serves also when we're dealing with immunological conditions. So you might hear IgG or IVIG periodically, but remember, this is a blood product. All right, so now we're going to talk about skin. This is the second part. Skin is the largest portion, largest organ of the body, as you probably already know. It protects underlying tissues and organs from trauma or infection. And we have to pay particular attention to skin, the color variations, the texture, the breakdown. And in children, they're more at risk of certain things simply because their skin integrity is not as strong as adults. So let's see. Skin has a lot of roles, as you can see here. It's protection from infection, protection from UV radiation. Melanin is the agent that actually gives people of color their dark color. It acts as to cool. There's certain agents that help us stay warm as well. And as I mentioned, it does also, it cushions and protects us from trauma, like if we fall and so forth. In children, specifically infants, skin is thinner. It's easily to transmit through the skin any kind of type of virus or bacteria. With infants, the younger they are, they also lose heat more. They also lose water more, and they can have skin breakdown much easier the younger they are. Skin color and integrity is darker skinned patients can develop keloid formation. Folliculitis, as you've probably heard of, is higher in African American than they are in other races. And you have to pay close attention to how the color changes when they're in distress. We will talk about this more in respiratory. I actually have a picture of the way the color variation looks with a particular condition that will, I think Lyme disease, and we'll talk about later. So pay particular attention and do a really good assessment of the skin. The best time to do an assessment of the skin is during bath time. And a lot of people do not pay attention to the skin, and I'm telling you, it is one of the most important things that you must do, especially if you are working in a high acuity area where people can't really communicate to you something going on with their skin integrity. So I'm going to show you some pictures here. Just as a reminder, again, I told you that they're more at risk, and skin breakdown is a big deal. We do use the Braden Q. We have a scale of Braden Q specifically for our population in pediatrics. We have one for infants, we have one for neonatal, and we have one for children. And you just follow it. I'm not going to test you on it. I'm just mentioning it here. But one of the things that really causes skin breakdown in the pediatric population is devices. And there are certain devices that put them more at risk. So here, if you take a look at this one, this is, you would think that this is probably like from an IV, and it could be an infiltrate, but it also could simply be the fact that somebody did put to take too much, and their skin breakdown is just because of the device that was resting on that bony prominence area right there at the ankle, and it bruised the child. And then I wanted to show you what it looks like afterwards. So this, so meaning that there is going to be some scarring, and you can't really tell from the picture, but sometimes when we have some type of skin breakdown, or if we have an infiltration or damage to the area, it actually can affect the child's growth and development, because they're going to have to get physical therapy because now that joint doesn't form correctly. Up here are, well, let's go to the pictures first and I'll go back up to that. So this is from a pulse ox. So the light from the pulse ox actually can burn the area if it's not rotated. So one of the protocols is that you must rotate the pulse ox sites on your patients, especially your patients where they can't tell you that this is hurting. You should rotate your pulse ox site at least twice your shift. This is from a child coming back from surgery. I can tell you, I've seen so many of these. Coming back from surgery and sitting on one of these, or sitting on one of those surgical donuts, for example, and they're intubated and they are not moving, and they develop right here at the back, at the base of their neck, because they were sitting either on a towel or something that did not evenly distribute the weight of that area, and it's just putting pressure. And that is basically, you can't stage that one because you can't see it, but this is definitely a pressure sore. Those are very nasty. And then our NG tubes. So our NG tubes, sometimes depending on how they're taped, we don't want to take it out and put it back in, but the policy states if the child's going to need an NG tube for a very, 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 very long time, they probably should just get a G tube. But that's another conversation. But that's just because the nair, the NG tube broke down the area around the nair. Another thing that could do that is nasal cannulas or prongs or different devices that we put in the nairs to provide pressure support or some type of oxygen therapy. Now, going back up to these are what we call positioners, but there are certain positioners that can be used to distribute the weight better so that we don't have breakdown. But then there's also positioners that are used just a prop. You have to make sure that you use the right device for the right reason. And a lot of these things that are gel, like this one, actually can cause breakdown because it wasn't designed to distribute the weight properly. So I don't have examples of the other ones. I'm just simply going to let you know that that is a thing. keeping your patient dry, and also certain medications can also perhaps cause skin breakdown, like an IV infiltrate. So I'm not going to spend a lot of time on this one. This talks about rashes and lesions, because you should know this from not pharmacology, but from foundations. So skin lesions are described based on their distribution, meaning their spread, their size, location, and morphology, or form, otherwise known as. And I just have some of the terminology here, and I have some of the common type of described lesions or rashes. So when you hear me say lesions and rashes, so rashes kind of like is when the distribution is spreads, right? So then we're like, oh, you have a rash because it's spreading. But sometimes people can just have one lesion, one papule, right? But usually that's not necessarily the case. Usually if you have something that's affecting the skin, it will spread. But where it spreads and how vast it spreads depends on the pathogen. So, okay. So, let me see here. So erythema, we all know that's just a reddened area. So that's just saying something that's red. On African American and people in color, you may not necessarily see red area. Like for me, you would see, because I'm pretty light fair skin. But on certain people, it may not look that way. It may look like a dark purplish color. So you have to take that in consideration. Ecchymosis basically talks about bruising. So bruising does manifest normally. You know, there's different stages of bruising, but again, it may look a little bit different. Petechiae. So petechiae is pinpoint, tiny, like sharp, circumscribed spots that are superficial on the skin. So a good picture. Do I have a picture of petechiae? I think we have one later on. But petechiae is basically, it is usually spread just a little bit, and can occur usually for distress. But it also can occur, when I say distress, I mean like hypoxia, or it could be because of a virus. Okay. Then we have things such as dry, scaly, moist, crusty. Those are pretty self-explanatory. If something is raised or flat, when you're looking at it, you want to describe as raised or flat. Knowing the difference between a macule or a papule, as you can see here. So this is a macule, this is flat, and a papule is raised, right? If it's, you want the person to see, tell you, or you can see whether it's blistering, meaning it's erupting. A bulle is like a bully. That's kind of like, I call it like, it looks like a little mini cyst. That's what I call it. It looks like a little mini cyst. It's also important that if you do have something that's flat, that looks like it's spread, you want to see whether it's blanchable. So when you press your finger down, does the coloration go away? So if it's real, there's a lot of erythema, when you press down, does it, and you when you press down, does the skin change color or does it stay the same? All right. Blanchable is a good sign, because that tells us that there is perfusion getting to and from there. All right, so let's see, what did I get everything? Okay, I think I want to talk about primary lesions and secondary lesions too. So primary lesions are skin changes produced by a causative factor, like a primary condition. They usually what you'll see is like macules and papules and vesicles. And vesicles, for example, like chickenpox. We hardly see chickenpox anymore, but they produce the vesicles. A secondary lesion is a change that results from alteration in the primary lesion, such as those like the child is rubbing, scratching. There's some medication that actually does not do the job that we wanted to do. It does the opposite job. But basically, it's because we have done something to it, or the child has done something to it. So a lot of times it's important to not create a secondary infection or lesion, because we're not taking measures with a child who developmentally is just going to naturally continue to scratch or hurt or really do something to irritate that site. All right. Let's see. So I think the last couple ones I'm going to talk about different types of skin infections. So we're going to talk about bacterial infections, viral infections, and fungal infections. So bacterial infections, here's some examples. Staph is our leading one here. Usually it's gram-positive and cocci. What you usually will see is some impetigo or folliculitis, as I mentioned before. Treatment options are usually misoprostol. Love that. That ointment is only by prescription only. For some children, we might have to do bleach baths, which is only 4% bleach mixed with water. That actually can decrease the inflamed area. Like in this area right here with this child, we would probably have them sit in the tub with just 4% bleach. And it's not straight bleach, guys. It's just 4% bleach. And that usually can help decrease the inflamed areas. We can give over-the-counter antibiotics if it's severe, like doxycycline. And then testing the child and family to see if this is something where they're possibly colonized. If they are colonized with staph, then what we could do is there's like this whole protocol they have to do. And we put ointments, both nasally, sometimes rectally too, just certain areas where they really colonize and get that number down. It takes a while in order for this to be considered, non-infective, because people who usually colonize stay colonized for a while and they don't really have any problems unless they have a flare-up. And then we have our viral then we have our viral skin infections. These you probably have seen before. They're very common. They invade the host cells by multiply, and they basically can survive and become dormant. For example, here is a wart. So that is a type of virus, and you can make warts go away. There are some tricks to it. My daughter had a wart on her finger. Actually, she was a gymnast. And it took us forever to get the wart to go away. And finally I Googled, we did all these treatments and they were very painful. And she was like, Mommy, I can't do it anymore. And then finally I Googled and I found a remedy. I was like, well, hey, what the heck? It was just duct tape. And let me tell you, we did duct tape. It suffocates the wart and the wart goes away. But the wart is still dormant in her finger. She can still have it pop back up. But at least we know what works for her, which is duct tape. If you want to know more about it, just let me know, or you can Google it. Duct tape for warts. So, anyhow, identification is based on symptoms, right? And how it prevents itself. So, up here, this is chickenpox, y'all. So these are vesicles, and they do erupt. And they are very itchy. They are very inflamed. They have a base that's very red. And another examples are Rosella, which is human herpes virus 6. And then we also have herpes type 1 and type 2. So this one, let me see, this one right here, I'm trying to remember. So next one is, so make sure I'm telling you the right one because they look so familiar to me. This high fever can cause fevers. All right, so this one is German. So this is, this one, I believe, is German measles. This one here is herpes. This one's herpes. So none to say. Viral, we also get viral skin infections, and then we also get fungal skin infections. These are very superficial infections that live on the skin. There's another terminology called dermatocytosis. I think I said that correctly. And they transmit from person to person. They are highly infectious and communicable. And you also can get certain things from animals as well. This one here is considered ringworm. And this is capitis, so this is a fungal infection on the scalp. And this is a common one in our infants called thrush. It's basically yeast. The way that we diagnose and make sure that this is truly yeast instead of milk is that we get a gauze and we basically wipe their tongue, or it can be on the roof of their mouth. And if it doesn't come off, then we know that we're dealing with thrush. This is very, can become problematic for our infants because it's painful and it can make them stop eating and drinking, which can put them at risk for not only dehydration, but also malnutrition. This one is one you can get from the soil and you can also get from dogs. This is also highly contagious, easily treated over-the-counter medications, or it can be you can use something that could be prescribed. Ringworm, very, very, very common, and it presents just like this, and it is a burning rash. And then we also have the scalp rash. This is also very itchy, and this is also can burn once they've touched it for a little bit, and it also can cause hair loss in that area as well. Oh, I put this one up here. We have one more, erythema multiforme. You probably will not find this in your textbook because I think it's important that nurses are familiar with this one. I absolutely can't stand this disease and this condition that affects the skin. It's like dealing with a burn patient, but it's called Stevens-Johnson syndrome. The cause is really, I can't say the cause is unknown. They can't isolate a cause, so to speak, but they do know that there is a high correlation with some drugs, like Tylenol, believe it or not, Dilantin. Those are two main drugs that can cause this. Don't freak out. Still take your Tylenol. But those are associated with the ingestion of some drugs, and then it also often can follow a upper respiratory tract infection. So basically, this is a papular rash that forms lesions that enlarge over the skin and surface areas, including the eyes, the mouth, in the genital area, and it is extremely painful. And what I like to describe it as is that the skin just sloughs off. That's why it's like when people have burn patients and when they're first burned, they call this process called degloving. And it's just when the skin, the top layer of the skin just comes off and then you see the pink area. All right. So, and that's what happens here. And that is basically what's happening. It starts in one particular area and it can spread throughout the entire body, as you see this little boy here. I think it's a boy. Maintenance is treating just like a burn patient. They get gooped with antibiotics. They get oral antibiotics or IV antibiotics, and they also get clean because you do have to clean them. But the reason why I don't like this condition is because every time I touch them, I'm hurting them. And it's just very, very difficult. The wound care nurse is a gift from God on here because they give lots and lots of things that help the patient feel better. Obviously, lots of pain management here, lots of pain management. If it gets into the eyes, it can actually cause blindness. They obviously are not going to eat, so they're going to need to have an NG tube. If it gets into the mouth, if it gets into the groin area, it can affect urination, so their output. So they would probably have to have a Foley to make sure that we are monitoring their output. Their H&H is going to be altered because they have a lot of bleeding that goes on, and electrolytes are going to be off. It's just a total wasting. And then eventually it does clear up. It does clear up. Their skin grows, the inflammation stops, but usually they have to go through some type of rehab because their mobility is altered, and they just have to get their strength back. So the high morbidity rate, as you see there, is one of the bullet points, is because they are increasingly at risk for infection. So there is a 10% mortality rate for this. So anyhow, I just wanted you to know about that one. There is a possibility you could see a child at Children's, because this has happened many, many, many times, and it can happen for just multiple different reasons. All right, so last part, we're going to talk about communicable infections. So preventing communicable diseases in the pediatrics, I already stated, was immunizations, good hand washing, good teaching etiquette to children, initiating transmission-based precautions in the schools as well as in frontline areas in the hospital, such as urgent cares and in emergency departments. Teaching families to avoid tick-infested areas, using repellents like with DEET, or, which I don't like DEET, by the way, but they say to use DEET, something that prevents mosquitoes or insects from biting them. Wear light color clothing if they are going to be out, like in the summer months. We all know that here in Georgia. And mosquitoes and certain arthropods are drawn to darker colors. And then teaching families how to check for ticks when they come inside. Looking at those armpits, any moist areas, the groin areas, the hair. Just understanding that children could be out there playing and get a tick. And if getting those ticks off, not only them, but also the dogs could be bringing it into the home. All right, so we're going to go through quite a few of communicable diseases. The first one is conjunctivitis. This is the inflammation of the conjunctiva. It occurs from a variety of causes that are usually typically age-related. In newborns, conjunctivitis can occur from infection during birth, which is why we give the ointment in the eyes right after they're born. It could be because mom has an STD, specifically chlamydia or gonorrhea. Conjunctivitis can be a serious condition. It can lead to blindness. Clinical symptoms of conjunctivitis are similar to what we normally see. We probably had at least one episode of conjunctivitis as a child. We have that yellow drainage, which is classic for bacteria. Usually the child will wake up and their eyes will be closed. They'll have lots of also drainage throughout the day. They'll be complaining of itchiness or redness or swelling. And there are also some other things that could happen. For example, there could be a blocked tear duct, which can also cause to a decrease of proper draining, which can cause conjunctivitis. Children also can have foreign bodies or certain foreign objects get into their eyes, and that actually can cause an infection as a result from them having a foreign body or chemical or something that actually affected their eye or eyes. Treatment is depending on whatever the agent is. So if it's viral, usually they just watch it. But if it's bacterial, they'll just go ahead. To be honest, I haven't seen a child with conjunctivitis that did not go ahead and get treated with eye drops. It is highly contagious. So everybody around the child needs to know that they also might get, we also call this pink eye. And we usually put them on antibiotics as well. Stomatitis. So this is actually currently, as I'm recording this, there's an outbreak in Georgia with stomatitis. Stomatitis is an inflammation of the oral mucosa, which may include the cheeks or the lips as well, and the floor of the mouth. It may be infectious or non-infectious, depending on some other like systemic factors. In children, this is typically seen in the younger children. They usually have this slapped cheek look. You see right here. Nobody is like really red cheeks. That's because of the infection in the cheek area. Excuse me. Children who are immunocompromised, who are receiving chemotherapy or any type of radiation, are really at high risk for getting stomatitis. So it can actually cause ulcers, and you'll see also some breakouts on the hands and the feet. We also call this hand, foot, mouth disease. And this, again, is a virus. and most likely. And so therefore our main priorities as a nurse is to, one, relief of pain, because it can be very painful. Really pay attention to their oral intake. Anything that is affecting their mouth, their cheeks, you hold the whole area in order to intake, they're going to have a decreased intake. So we have to make sure that we might need to put an NG tube down, IV, and prevent them from being dehydrated. And then the prevention of the spread, because this can last for about good 14 days before everything is healed up. Intestinal parasites. So we have all heard about this. This is also another one that's an outbreak, but that's just because this is currently the winter month. So we have intestinal parasites. These are, I'm just going to talk about them individually because I think the treatments are different, obviously. So pinworms. So pinworms, or I can't say tapeworms, I would just say pinworms. So that's a picture up here at the top. Can you see that? Yeah. Okay. Yeah. Pinworms. This is something that can be picked up at a daycare center. And it is also the most common intestinal infection in the United States. The reason why they say daycare centers is because transmission is usually favored in crowded conditions like classrooms and daycares. The infection begins when the eggs are ingested or inhaled. So that also means that, these eggs can be passed on to people very easily in the household because they can float in the air. Once they're hatched in the intestines, they end up having these little worms. And then usually people can say that they feel like intense itching and worms because the worms are crawling on their skin. And then at night, typically younger children will have what we call this itchy butt because they do come out through the anus. That is a picture of an anus at night. So it's in one way that we diagnose this is we use this special type of tape that is used in the anus at night, and so they come out and they end up getting stuck on the tape, and then the tape, we look at the tape and the tape tells us we can see the worms, and so we know that they have pinworms. All right. This can last for about 2 to 3 weeks. So if there's an outbreak in a center or a home, there's this whole protocol of decontaminating the area, wiping such down, doorknobs, really trying to cleanse the area to get rid of the pinworms. I know you didn't want to hear all that, but sorry. All right, so protozoa. This is another one. This one is not treatment necessarily through cleaning, but this is going to be treatment through antibiotics. So you would, the child would receive Flagyl or Tindamax. Really basically the priority for nursing is to get a good history of the symptoms that they're having. Sometimes we can utilize things like the tape and so forth to really identify what we're dealing with. And then assist education and treatment. Later on, I'll be talking about lice, which is a different type of infection. But there are people out here actually who specialize in helping families clean their homes if they consistently are getting outbreaks from both parasites and other type of, I want to call them creepy crawlies, but lice and scabies and all these different things. All right, next one. I don't think this is in your textbook. I think this is another one I added. And because I think arthropods is something that we definitely need to talk about in Georgia. And if you didn't know, this thing gives me the creeps. This one up here is called the brown recluse. So this spider is a very important spider to know what it looks like and to stay the heck away from it because it actually causes necrosis, and the necrosis starts to happen immediately after it bites. They say you cannot get to the emergency room fast enough before you lose your limb. That's how bad that venom is. But we know that arthropods, whether it's a mosquito, flea, a spider, a bee, a scorpion, or ticks, they all have some type of venom. They all have some type of saliva that can be injected into humans, and it can cause different things. So for the sake of, for the purpose, because these things are all kind of different. Mosquito is definitely different than a spider. Spiders have venoms. Mosquitoes have, I would call it venom, but it's not. I don't think they classify it as a venom. But they all have something that they inject into us and how we treat that. And children specifically are very curious. And so a spider like that, to some children, they're like, oh, what's that? Snakes. Snake season. When snake season happens, children are always curious about snakes, and they go up and they want to touch the snake, and the snake bites them. And then we have to give them anti-venom therapy, which is what I'm going to show you on the next slide. All right. So arthropods can come in different shapes and sizes. The black widow is another one that's found here in Georgia as well. The venoms are very deadly enough to require immediate action, and anytime a child is bit by anything, you should always take them in, especially like even bees. If their reaction is unusual to a normal bee sting, you definitely need to take them in, because that is also considered an allergy. So some of the parent education that we share with families, and you need to be aware of it as well, is to never handle or pick up the snake or try to trap it, or the spider. Do not wait for symptoms to appear. If they are bitten, get them to an urgent care or to an ED right away. I would say an ED, because urgent cares do not have antivenoms. Do not apply a tourniquet, because that actually can make the symptoms worse. Do not slash. Do not try to suck out the venom. Don't try the stuff you see on TV. Do not apply ice. That actually can cause the symptoms to be worse. Don't drink alcohol as a painkiller. I'm laughing because I know a couple families who have done that. And don't take anything. They basically need to get to the emergency department so that we can start to stage it to see what it looks like. So some of these pictures, as you can see here, these are pictures of, I would say, I think these, from the look of it, what they're doing, this looks like, it's definitely a brown recluse, or it's definitely a snake. Yeah. Let's take a look at what we do for anti-venom therapy. So Crofab, there's another one, but Crofab is the most common anti-venom in the United States. They actually had the market until this new one just came out. There is a whole indicator that we do to score whether or not we need to give Crofab or not. But as you can see, this is this child when they came in, and we will put a mark where the swelling is up to. And then we have to write the times. We have to do this every hour, or even probably more frequent if necessary. This is this child going all the way up. And you really can't see the day on this. But basically what you're seeing is us marking the times of the swelling. So the swelling was only to the ankle, but then as we were measuring it every hour, it kept going up. This child definitely should have gotten Crofab immediately here. And then these are the fang marks. Okay. It is administered IV slowly for the first 10 minutes. It's not really necessarily a ICU thing, but if the child is having other symptoms besides swelling and pain in the area, then we definitely will need to have them monitor more closely. Copperhead rattlesnakes and cottonmouth snakes are the most common ones we see here in this area. If somebody is getting Crofab, they cannot if somebody is allergic to the papaya, they cannot have Crofab. Side effects also include itching, redness, nausea and vomiting, pain on top of the pain that they're already seeing, and swelling at the site. It takes, like this patient here, I would say it would take this patient almost a week to get that swelling to go back, to feel like they can actually put weight on that leg. next we have Zika virus. So Zika virus, we all know, is more prominent in really humid areas. It was initially discovered about 70 years ago. It is transmitted to humans primarily through mosquito bites. The virus can be transferred from mother to child during pregnancy. And there's no current evidence that Zika is in breast milk, and so mothers can continue to breastfeed, but it can cross the placental barrier if the mother is infected while the child's in utero. Usually you'll see some fever, a maculopapular rash. They probably will get conjunctivitis 3 to 12 days after being infected, and the symptoms really will last for up to 7 days. The thing about Zika, especially if it's something that's transferred in utero, these children can develop a serious neurological condition called encephaly, or they can have some type of lack of brain development and be born with severe cognitive delays. So if mothers who develop these symptoms should be tested for Zika. When I say mothers, I mean pregnant women, They should be tested because the Zika could have so many brain defects. It's something where they need to be monitored closely. Lyme disease. So Lyme disease is the most common tick-borne disorder in the United States. It is caused by Borrelia. Borrelia. Basically enters the skin and the bloodstream through the saliva of the tick, especially deer ticks. And with Lyme disease, there are 3 stages of illness. As you can see here, first you'll have that pinpoint. Do you see that? Oh, I'm going to show you on the next slide. I'm going to come back to this one. You'll have that pinpoint rash right here. And this picture here is a picture of somebody who has darker skin. So that pinpoint rash looks pretty different, right? So it's really easy to see it on fair skin, but it's not on darker skin. Because a lot of times, like if you look at this, you're like, oh, I just bruised myself, right? Here it's pretty evident that there is something going on. So you got to pay attention to that. And then we get these annular rings when it comes to, that's the next stage. You'll have these annular rings, and then it goes away, right? And if the patient doesn't go ahead and respond to these rashes or notice it at all, then they are not going to realize that they have Lyme disease. And Lyme disease is a condition that is a chronic condition for many people in the United States. So management includes particularly early identification and treatment with antibiotics. And the main antibiotic is doxycycline. Now this is different than Rocky Mountain spotted fever. This is also caused by a tick bite. Incubation period for this one is 2 to 14 days. Whereas for Lyme disease, the incubation period and that whole 3-stage period can go on for months. Okay. Rocky Mountain spotted fever usually happens pretty fast. The fever, they'll have fever, they'll have lethargy and headaches. I've taken care of 2 people with Rocky Mountain spotted fever, and they were actually camping right before they got infected. So we knew, well, okay. Very popular in Georgia. You may not see a lot in your book about this one, but I want you to make sure you know the difference between Rocky Mountain spotted fever and Lyme disease. This one has a maculopapular rash or petechiae on the extremities. This is treated with antibiotics and prevention education. These children and these patients must be in the ICU. They are at severe risk for dehydration. They get a boatload of fluid. They feel horrible. And there's other things that we have to do to them to maintain them Electrolytes are also from a hematology standpoint. But one of the main things with these kids is that they are severely dehydrated and they're also in a severe lot of pain. So now let's talk about the difference between scabies and lice. Scabies is an infestation caused by the scabies mite. Lesions are created as the impregnated female buries into basically the skin, and they deposit their eggs and feces on the skin, and then the eggs will hatch, and then the process starts all over again. They cause a lot of inflammation, and so therefore there's a lot of itching as well, because the eggs hatching and the burrowing in the skin. Macropapular lesions or rash is usually what you see, and they excuse me, they're usually in folds like armpits, neck area, as you can see here, but this one is like on his back and so forth as well. There could be areas in intense, when I say intense itching for these children. They are usually children who may not be housed, so they are more at risk for getting infestation by the mites. We use a cream over the entire body, even areas that may look like they are not infected. So this is the Emolite cream. And we treat the entire family, because usually they're close enough to get infected and not really know that the scabie is burrowing into their skin. Whereas lice, this infestation is in the hair. Usually this is just specifically, and I'm scratching my head as I'm saying this. Both are contagious. This is on intense itching on the scalp versus the skin. And that's because of the movement of the lice. You'll see the nits on the hair. And here we use the cream, the Nix cream. There's also shampoos as well. Again, here we would treat the whole entire family and close friends. Children who have scabies and lice cannot go to school for a particular period of time because they would just infestate the entire classroom. Let's see what else I want to tell you about this one. So know the difference between the two. They're pretty self-explanatory, and then how we treat them. COVID-19. So COVID-19, I believe this is the last one. So COVID-19, MISC, I have the page number listed there. It's actually listed a couple times in your textbook, but I think that page is the best page to read on it. This is a multi-system inflammatory syndrome in children that is only seen after they have COVID-19. It is a massive inflammatory process. These children are in the ICU. They have fever above 38 for more than 24 hours after having COVID. This is usually seen after they've gotten over COVID, by the way. They have high inflammatory markers, as you see listed there. Their electrolytes as well as their CBCs are very altered. Usually, big thing with these kids is that they usually have huge cardiac involvement, and they also will have, it's not necessary, we don't see a lot of neurological cardiac involvement, immunology involvement, and there was one more. Maybe it's hematology. I think it's hematology. Because we have to put them on anticoagulation therapies because they can go into DIC. We have routine endocardiograms, and they're put on massive steroids. And it would not be surprising to see these children to get that IVIG that I talked about earlier, because that will help with to decrease the systemic inflammatory process that's happening. All right, I believe that's the last slide. So just took about 30, not 30 minutes, I wish. Took a little bit over an hour. If you have any questions about anything, let me know. I know I didn't go full in detail, but this is basically your outline of the diseases and the conditions that you do need to take a look at for this lesson.